Very good evening, friends. Meeting again in the session of Materia Medica after a big gap. So, happy Diwali and happy New Year to all of you. So, we're going to learn very short remedy from Borix Materia Medica and from fourth year syllabus, that is Adonis Vernalis. It is a pheasant's eye. Then common name is very important because that pheasant's eye, what is exactly mean by pheasant's eye? I want to show you a certain thing regarding it. I will share few things. What is exactly mean by the pheasant's eye? Pheasant's eye, it is a European folklore where the pheasant's eye is often associated with death and remembrances. Its appearance in cemeteries and memorials underscores its role as a symbol of lost love and memory. It was a popular flower during Victorian era when flowers were used to convey unspoken messages of sentiment and emotion. And there is one more meaning of it. It is a view from high angle as if seen by a bird in flight. That is another meaning which has been mentioned. An overall cursory look at something is also pheasant's eye. This remedy is very important for us. I have used it many times wherever the valvular heart troubles are there, rheumatic valvular heart troubles are there, and when it is associated with chronic passive venous congestion, with cardiac asthma, I have utilized this remedy many times. It is a wonderful remedy to be used in such types of cardiac failure cases. In one more case, I have utilized in infective focus where there was a first influenza and influenza followed by myocarditis was there and tremendous weakness in musculature, and it was called to be a case which is very difficult to cure, and I have started Adonis Vernalis mother tincture, only 10 drops 3 times a day, and patient recovers so fast with the CCF. There was recovery, the urine output was increased all of a sudden, the strength of muscles recovered, and patient got again a good strength. It is a wonderful remedy in two diagnoses where I used to think Adonis Vernalis. First is rheumatic endocarditis and specifically a post-influenzal myocarditis. These are two things where one must think of Adonis Vernalis and where it is associated with cardiac asthma or cardiac weakness, cardiac debility, the cardiac edema over there, dropsy over there. It is a wonderful remedy to be think of. It's a very short remedy. We'll read it from Borix Materia Medica and we'll understand what exactly it means. So Adonis Vernalis, its plant, its flower, pheasant's eye, a heart medicine after rheumatism and influenza. Understand this sentence. Post-influenzal complications of the heart and post-rheumatic complications of the heart, both where there is a role of Adonis Vernalis. A wonderful remedy to be think of. Or Bright's disease, heart medicine or Bright's disease. Bright's disease is glomerulonephritis. It is again when kidney gets compromised because post influenza or post traumatic disorder. This is one remedy to be think of. Where the muscles of the heart are in a stage of fatty degeneration, regulating the pulse and increasing the power of contractions of the heart with increased urinary secretion. So cardiomyopathy, post-traumatic cardiomyopathy, post-influenzal cardiomyopathy, wonderful remedy to be think of is the Adonis Vernalis. It is not slowly progressing degenerative stage which happens generally in digitalis. It is not like that. It is an acute, generally after certain specific disorders. Then it has significance. Most valuable in cardiac dropsy. This is the sentence. Cardiac dropsy is nothing but the It is left ventricular failure, because of which the left atrial dilatation is there, hypertrophy is there, the pulmonary congestion is there. Because of pulmonary congestion, breathlessness is there. Because of pulmonary congestion, the post chronic passive venous congestion and dropsy develops over there. Typical pathology which happens to be there is the seat for Adonis Vernalis. Low vitality with weak heart and slow weak pulse. This is what we have learned. This is very weak pulse because of the cardiomyopathy. Hydrothorax and ascites. Hydrothorax is secondary to the cardiac failure. Pulmonary congestion, because of which hydrothorax happens. Same thing, because of the chronic passive venous congestion, the ascites develops over there. Anasarca, generalized edema. But most strong action is on heart than on the kidneys. But there is a kidney affection is definitely there associated with a urine, quantity of urine becomes decreased over there. Head, head feels light. It aches front from occiput around temples to the eyes. Vertigo on rising, turning head quickly or lying down. And this vertigo is generally because of the change of position, the positional vertigo, or sudden change in patient's blood pressure, the postural hypotension. This happens more commonly. Think about this remedy. Tinnitus, secondary to the less blood supply. Scalp feels tight, eyes get dilated. The mouth is slimy, tongue is dirty yellow, sore feels scalded as if scalded. Now, most important aspect is heart. And heart, you have to understand whole pathology. Heart, there is a mitral and aortic regurgitation. See the pathologies. These are most commonly post-rheumatic disorders. Aortic regurgitation, mitral regurgitation. These are post-rheumatic chronic aortitis. This is one more very important remedy. Fatty heart pericarditis. All three layers of the heart are in fault. Either pericarditis, then rheumatic endocarditis like Kalmia latiafolia, like lithium carb, precordial pain, the palpitation and dyspnea. There is a pain in chest associated with palpitation, associated with dyspnea. Marked venous engorgement. This is because of cardiac failure, because of which chronic passive venous congestion, because of veins becomes dilated, engorged. Cardiac asthma. This is given in italics and it has a specific meaning. Fatty heart, the myocarditis. This myocarditis is the complication of post-influenzal disorder. Irregular cardiac action, constriction and vertigo. Pulse is rapid and irregular, and that pulse is not full bounded, it is weak, very weak. Stomach, there is heavy weight, generally happens to be there because of gnawing hunger which develops over there. The faint feeling in epigastrium, better out of doors. Urine, oily pellicle in urine, urine is scanty, it is albuminous, indicates that glomerulonephritis is there. Respiratory, frequent desire to take long breath. This is again because of cardiac asthma. This is very long breath they used to take. This is common with this feeling of weight on the chest because of pulmonary congestion. Sleep, there is restless sleep with horrible dreams. Extremities aching in the nape of neck, spine is stiff and aching, and there is edema over the spine, over the extremities. Relationship, adonidine, this is the principle of Adonis Vernalis, is a cardiac tonic and diuretic. Quarter grain daily or 2 to 5 grains of first decimal trituration increases the arterial pressure and prolongs the diastole, favoring emptying the engorged veins. It is an excellent substitute for digitalis and is not cumulative in action. This is whenever the cause is known, that it is either infective myocarditis is there or it is rheumatic endocarditis is there and patient is acutely in compromised condition of the heart. Adonis is more important remedy than the digitalis. Compare digitalis, the crataegus, the convalary images, the strophanthus, all remedies having the heart action, but all of them are different. Dose 5 to 10 drops of the tincture. Yes, this is commonly used to be used in mother tincture form. Very occasionally, I have used the 3C, 6C potency, but generally, mother tincture of Adonis is wonderful in such types of cases where heart gets compromised, sometimes kidneys gets compromised. This is a wonderful remedy to be think of. So, very short remedy, but having a lot of meaning and lot of use in clinical practice. Specifically, whenever a patient is admitted in ICU or whenever the patient who has, you know that cardiomyopathy is there, you must think about this remedy. So we have finished one more remedy from fourth year syllabus, wonderful short remedy, but having a big meaning in homeopathic practice. One must learn it again and utilize in their practice. That's all for today. Thank you and good night. We'll meet tomorrow again with one more remedy.
Thank you, sir.